Hi, my name is Jeff Street, and I'm going to talk to you today about a healthcare company that has saved my family thousands of dollars a year. I've been self-employed for the last 25 years, and I've always been the person that was responsible for paying my own healthcare costs. And for years, I had no health insurance. I was in my 20s. I was healthy. I thought nothing's going to happen to me, and thank God nothing did. But when I met who is now my wife, and I knew I was going to get married, I said, probably should have healthcare. And for years, my wife and I have spent a lot of money on healthcare. But 4 years ago, somebody gave us a quote with a company called Impact Health Sharing. And we looked at the quote. It saved us thousands and thousands of dollars a year. It took our combined family deductible and split it in half right off the bat. And we looked at a quote that was $364 a month for our family. And when I saw it, I was blown away, but also thought this is too good to be true. But as I peeled the onion back and as I learned more, the more I learned more and understood about healthcare sharing, and specifically with this company Impact, I became a major advocate. I became somebody that just got really passionate on really believing that not only is this a disruptor, but this is something that can truly make an impact and make a difference for a lot of family, just like it did for mine. So here's what I realized as I started to learn more. Here's the truth about healthcare. 80% of our country is trying to lower their healthcare costs. But this second point here is really what made me understood why healthcare sharing could work so well for so many people. 5% of the population in our country is responsible for 50% of the annual healthcare costs in our country. This means the other 95% of the people, I was in that category, was responsible for the other 50%. So this indirectly means that most people are healthy or fairly healthy and having to significantly overpay for their healthcare costs to compensate for people that are not healthy. Healthcare sharing, as you'll see here in this short video, is really something that's designed for people that are healthy or fairly healthy. And since most of the people that are joining our community are healthy or fairly healthy, it drives the risk factor down significantly. And that's part of the reason why so many people can save so much money. Over 100 million Americans right now are in some form of healthcare debt. So the traditional health insurance model is not working for a lot of people. Now, healthcare sharing is not a new idea. This is a concept that's been around for 40 plus years. You may have heard of some of our other great brother sister companies in this healthcare sharing space, companies like MediShare, companies like Christian Health Ministries, companies like Samaritan. Some of these amazing companies have really paved the way for companies like Impact. Impact today is the fastest growing company that I'm aware of in the healthcare sharing space, and they're the most modern and contemporary version of healthcare sharing available today. Here's some of the benefits of Impact. Impact is not traditional insurance, but it looks and feels like traditional insurance. And you'll see what I mean by that here in a minute. There's no religious requirements. Even though we're governed by Christian principles, we have the love thy neighbor approach. So our members can be from any walk of life. You know, all creeds, all walks of life, all religion, come one, come all. You know, what separates Impact from other sharing programs is our technology platform, how we manage our billing. You'll see that here in a little bit, and the inclusive desire to help as many people as possible through our reference-based pricing system. Now, here's some of my favorite bullet points about Impact. Remember, Impact is not insurance. I believe for many of us, it's something better. It's a community approach to healthcare. There's no provider restrictions. Here's what that means. No network restrictions. Our members can go to any doctor they want anywhere in the country, and they'll never have to pay an out-of-network penalty fee. This is comprehensive healthcare, everything from car accidents to a cough to cancer. There's no utilization reviews. Here's what that means. Providers can actually diagnose and treat their patients based on their medical experience, not based on any restrictions from an insurance company's guidelines. Now, year-end enrollment. So there's no open enrollment with Impact. Somebody can sign up for Impact any time of the year. Whenever you sign up and complete that enrollment, your membership would begin the first day of the next calendar month. We have complimentary 24/7 free unlimited telemedicine. Also, every member has a complimentary annual wellness visit. So a free annual wellness visit or physical, or for ladies, you can use that for your ladies visit as well. And what's really exciting is Impact has their own concierge service as well. That if for any reason, when you go to your primary, when you schedule for your primary care physician, if for any reason they do not want to bill Impact or accept Impact, you can call our concierge team and they will call and they will make the payment ahead of time, even before you walk into the office. They will prepay your annual wellness visit. And I've never heard of a healthcare company ever doing that before. Also, every member gets a $150 lab work credit or blood work credit per year. We have one of the best wholesale prescription pricing in the industry, and every member gets a free dental and vision discount card as well. Personally, I've used a dental discount card for years. I used to use it through a company called Aetna. I paid a few $100s a year, and they had contracted negotiated prices where I already knew what I would pay for dental procedures, and it saved me a lot of money. Now, with Impact, our program is through Carrington, and it's included as being an Impact member for no additional cost. And there's savings on average of 50 to 65% on dental costs. Now, we also have something called a health and wellness credit. I love this part where if you are proactive about your health and doing your right things, the right things, Impact is going to reward you for being proactive with your health with our health and wellness credits. So every month you can qualify for up to $150 in health and wellness credits. So any family that spends up to $150 a month in health and wellness, or $150 or more, you get up to $150 credit every month to offset what's called your primary responsibility amount, which is like a combined family deductible. So for my wife and I, we spend well more than $150 every month on health and wellness. So every month we submit that receipt and we get a $150 credit every month to offset that primary responsibility amount. It's like buying down your deductible every month, which is amazing. But what qualifies for these health and wholeness credits? Direct primary care memberships, naturopathic services, holistic wellness, naturopathic medications, gym memberships, fitness classes or subscription, massage therapy, acupuncture, supplements, healthy meal plans, just to name a few. And I love that Impact is a company that's not just looking for a healthy customer base, but rewarding people for doing the right things to stay healthy. So who is Impact for? Impact is for individuals, families, entrepreneurs, folks that are self-employed, service industry workers, seniors, any senior 65 years old or older, as long as they have Medicare Part A and Medicare Part B. Impact has a program called Impact for Seniors that can replace their supplemental plan. Also, small businesses. Our target market is businesses with 49 employees and less. And healthcare is a major problem for so many small businesses. And we've been able to help a lot of small businesses offer affordable healthcare to their employees. Now, the guidelines with Impact are super transparent. If you go to impacthealthsharing.com, you can pull up their guidelines and everything is right there. It's really easy to understand. Now, with healthcare sharing, not everybody's going to be the right fit for healthcare sharing. I mentioned earlier on, our target market are for people that are healthy or fairly healthy. Here's what I mean by that. Anybody can become an Impact member. Anybody would be welcome to our community, but you have to decide if it's the right fit for you. If you're somebody that's had a lot of chronic illnesses, Impact might not be the right fit for you. If somebody has a pre-existing medical condition, which we determine a pre-existing medical condition would be anything where there's been signs, symptoms, testing, diagnosis, treatment, or medication over the last 36 months. If you have anything that falls into that category, those medical bills would not be shared by the Impact community until you've been sign symptom treatment free for 36 months. The exception to that is high blood pressure and high cholesterol. If you have high blood pressure or high cholesterol, as long as that's under control, that will not be counted against you for any future cardiac or vascular events. Now, again, the way Impact works, again, this is for anything new accident, new illness, new injury, anything that happens after you become an Impact member. Now, this is the Impact membership card. So it looks and feels like traditional insurance. So when you go to the doctors, you just hand them your card, and we have an EDI payer ID number on the back of the card. What that means is the provider can just put that in their billing system and bill Impact directly, just like they bill an insurance company. Now, Impact's very provider friendly. One thing we're very proud of is right now we are processing and paying medical bills in under 15 days time on average. And we're paying those bills at fair market value. So we're paying our providers faster typically than the insurance companies, and in some cases a little bit more. So you go to the doctors, you hand them your card, they bill Impact. That's how it's architected and designed to work. Now, if for any reason anybody ever gives you provider pushback, maybe they'll say, no, you're with the healthcare sharing company. You have to pay first as a cash pay discount and wait to get reimbursed. Here's what you say. Look, I understand that's the way it usually works with healthcare sharing, but my company is different. Just put that payer ID number in your billing system and you'll see you can bill us electronically like an insurance company. Many times they do that and say, wow, you're right. Sometimes maybe they would still give your provider pushback. No big deal. They can just call the provider support line on the back of your card, and somebody from Impact will let them know how quickly we pay and how much we pay. And for many providers, that's music to their ears, and they'll be excited to work with Impact. As a worst case scenario, if for any reason that provider does not bill Impact, as a worst case scenario, you can be treated like most healthcare sharing members and just say, hey, listen, no problem. Just bill me as a cash pay discount and just submit that medical bill to Impact. If you haven't met your primary responsibility amount or combined family deductible yet, Impact will just apply that amount to your primary responsibility amount. And if you already have met it, Impact will reimburse you as a member on average as quickly as they're paying their providers, again, in under 14 days time, which is phenomenal. But let me show you how simple it is to get a quote to see what the price is going to be for you and your family when it comes to Impact. So whoever invited you to look at this video, they're a referral partner with Impact, and they have their own website that looks just like this. Now, on the website, you can watch a 5-minute video where you can learn a little bit more about Impact if you want, or you can just and then you can just check this box here at the bottom and click Shop Now for Impact Health Sharing. Now, when you go there, you simply just click on Get Quote, and within seconds, you can get a quote for your family. All you do is put in the date of birth of the oldest person in your family. Let's say it's March 30th, 1989, and let's say it's a family of 3 plus. We click on Get Quote, and it generates a quote for that family. Now, every time a quote is generated, 4 options appear. Now, on all these options, everything is exactly the same as far as what's shareable by the community. The only thing that differs is the amount that you choose for your primary responsibility amount, which again is like a combined family deductible, and the standard rate, which again is like a monthly premium. So there's going to be 4 different primary responsibility amount options: a $2,500, a $5,000, a $7,500, and a $10,000 annual primary responsibility amount. Now, the lower the primary responsibility amount, the higher your monthly standard rate is going to be. The higher your primary responsibility amount, the lower your standard rate is going to be. Now, my wife and I currently have a plan where we have the $2,500 annual primary responsibility amount. So I'm just going to use that as an example. So in this case, for this family, that would be $576 a month for that family of 3 plus. Now, in the insurance world, typically somebody will have a deductible, maybe an individual deductible that they have to meet. And once they meet that deductible, then they'll go into what's called co-insurance, where maybe it might be an 80-20 split or a 70-30 split, where once they meet their deductible, the insurance company is going to cover a certain amount, and then the member pays for the difference. So with Impact, the way that it works is, remember, it's like a combined family deductible. So as a family, once you've met that $2,500 primary responsibility amount, then at that point moving forward, 90% of your eligible medical bills are going to be shared by the Impact community. So the community will share in 90% of your medical bills. You're responsible for just 10%. That's called a co-share. And the most that a family could ever pay per year in co-share is $5,000 a year per family. Think of that kind of like a max out-of-pocket expense. If you ever hit that amount, then at that point, Impact will share into 100% of your eligible medical bills. Now, let's say instead of a family of 3, let's say you also happen to be 36 years old and you want to see a quote for 1 person. I click on Get Quote. There's a quote anywhere from $102 a month to $246, depending on which primary responsibility amount that individual chooses. Now, if you're like, hey, I still have questions, I want to learn more, you could submit yourself in as a lead on this portal, name, email, phone number, click request information, and somebody from Impact will send you a text message and an email with a calendar invite to schedule a call with you to help get any questions that you have answered. Now, after the video, if you're like, hey, I'm ready to sign up as an Impact member, all you have to do is just go to your referral partner's website and simply just click on Enroll Now. And it takes on average less than 15 minutes for a family to get enrolled as an Impact member. Now, let me show a couple other things to you guys. Number one is I want to show you what happens when somebody goes to the doctor and the doctor bills Impact. I mentioned before, Impact has what's called reference-based repricing, reference-based pricing. So they're going to advocate for their members. Matter of fact, let's say you do have some small pre-existing conditions and you do determine that Impact is the right fit for you. They will still negotiate your bills down to fair market value anytime that bill is sent to Impact. But here's a few examples. This was actually my mother-in-law. She went to the emergency room here in Highland Village where I live. The medical bill was $2,500 that was sent to Impact. Impact advocated on her behalf, renegotiated that price down to $164.98. Now, she had not met her primary responsibility amount yet, so she had to pay that $164.98. But look at how they repriced it from $2,500 to $164.98 as her advocate. Now, let's say this had been a pre-existing condition. They would have done the same thing. The only difference would have been that $164.98 that she paid would have not been applied to her primary responsibility amount. Now, here's an individual that had two children that had their tonsils taken out. They went to the hospital in Houston. One of the bills was $65,000. The other one was $46,000. This family had already met their primary responsibility amount, but check this out. Impact advocated for that member. One bill was repriced to $6,400 and change. The other one, $5,700 and change. They had already met their primary responsibility amount. So all they had to pay was the 10% co-share. And so you can see that the Impact community on the bill to the left, the community paid for $5,770 of that medical bill. The member just paid for $641. The other one, $5,130 was paid by the community. The member paid for $570. So on $120,000 of medical bills, that family only had to pay right around $1,200. Now, here's an individual that's going through stage 3 cancer, and they had already met their primary responsibility amount, and they'd already hit that $5,000 max amount they'd be paid for that 10% co-share. Here was a medical bill for $70,000, got repriced to $15,000 and change, and the Impact community paid for all $15,000 of that medical bill. That member's responsibility was nothing. Now, let me show you one last piece. This was something that just made me so excited about the transparency that was available with Impact. I'm just going to take you to my own personal member center. So here's me logged in as a member. With Impact, this is decentralized reserves. Again, this is a community approach. Myself and the other 18,000 plus members that are part of the Impact community, we all have a dashboard that looks just like this. And I can see what amount of money is just sitting in my dashboard. Right now, there's $2,300 just sitting in my share account. I can see what families I've recently helped. I love this part. It gives me fulfillment. I can send them a get well notice. I can pray for them. I can send them a prayer, or I can remain anonymous if I choose to. And also as a member, if you don't want your information published where the people that are sharing your medical bills can see that, you can remain anonymous as well. But I love that part personally because I love that what I'm paying every month for my monthly healthcare costs is actually going to real people. I can see what's happening with my money. I can see what's going towards program fees, what's going towards administrative fees, what's actually going to the share account, what's helping these families. And I can also see the entire community as a whole. They have full transparency. You can see how much money do they have in financial reserves? How fast are they paying medical bills? How many members are part of the community? You can see right now there's $12.6 million just sitting there in financial reserves at the filming of this video and in the share amount. You can see 18,237 members as part of the community. You can see in the last 12 months, Impact has shared in $13.1 million of medical bills. Now, the goal of a healthy healthcare sharing company is to have 3 to 4 months of financial reserves In Impact, we have more than 10 months of financial reserves. And because the company is so fiscally strong, that's why now they're doing things like that free dental and vision discount card. That's why they have programs like the $150 health and wellness credit. Impact truly is a member-centric company. You can even see the largest shares that were met last month: 130,000, 125,000, 51,000. These are real families that a community of people just like us, as we pay our monthly standard rate, which is our share amount, just like a premium, that just goes into the community. And through the magic of technology, through an algorithm, when a medical bill gets submitted, that technology is just reallocating funds through those decentralized reserves. And as a community, we're able to help each other pay each other's medical bills. And you can see from the financials that the model is just working really, really well. Now, we also have a Facebook group that you can become a part of, where we have lots of real life stories, amazing member testimonials. We do an educational webinar every single week, every Tuesday at 11 a.m. Central Time, where we do a much deeper dive with the information that I just went over. And you can join our Facebook group. You can scan the QR code. You can hop on to one of those calls. But as I wrap this up here today, for those of you that are wondering, wow, like you talk about a referral partner website, is there a business opportunity here as well? The answer is yes. So if you're somebody that wants to be part of this crusade with us and you want to learn more about how you can earn residual income by helping individuals, families, and small businesses, get back to the person that sent you this video and let them know, hey, I want to learn more about the business opportunity and being a referral partner. And they'll make sure they get that information as well. But I hope this information served you. We are making an impact, and we appreciate you spending the time taking a look at this video here today. Impact has made a major impact on my family, and I hope it's something that can be a blessing for your family as well. So God bless everybody. Thanks for tuning into this video. Back to the person that sent you this video. If you're ready to enroll as a member, and you want to just know that anytime you enroll as a member, your Impact membership begins the first day of the next calendar month. There's a one-time $75 application fee per family. So you pay that $75 while you're enrolling, and then you can choose each month what day of the month you want your monthly share amount to come out of your checking account. It's done through EFT. So God bless everybody and have a great rest of your day.